Now let's go and proceed with non-Swedish massage techniques. So these are the trigger points, fascial techniques and such. So that's what we are gonna be doing, okay? When you're doing a treatment, each technique has its own level of depth, you know, like how what's the extent, or what's the most like where are they applied best is the question. Because you can do fascial techniques at the end, but maybe it's better towards the beginning. You know what I mean? So and when you read the clinical massage therapy book, or the green book for some people, usually they suggest that fascia starts first, then trigger points, then friction. So for treatment station, my suggestion is you do the same. For acute conditions, the common techniques that you can use for that is, if there is swelling, manual lymphatic drainage, and then you can treat above the problem by general Swedish techniques that I showed you earlier. Okay? And then you can also treat GTO techniques, or ONIs, origin and insertion techniques. I think it's part of Swedish, but I didn't add that on the other one. Yeah, but you can use that accordingly, and obviously treating the compensatory area. That's usually how acute works, because there's nothing much that you can do in acute for now. But the gist is that you usually start with manual lymphatic drainage, then you can do Swedish techniques above the problem area, then you can do indirect techniques like GTOs or O's and I's, depending on the areas, and then treat the compensatory areas. If it's early subacute, because it's still acute, you follow the same thing, but instead of now treating above the area, you can treat around the area if it's possible, and then do the same thing. If it's late subacute, you can actually treat a little bit distally now, and then around the area, and then treat the same as acute. The only difference for late subacute is that it will start to have chronic symptoms. So you can start doing your trigger points, your fascia, but my suggestion is do that later. But for chronic, okay, it's usually going to be fascia, then trigger point, then friction if needed, and then you can pick from PNF, joint mobilization, then you can do, yeah, everything that you want to do. But for me, you want to do fascia, trigger points, and then you pick the third technique that you wish to do, because that would be the logical sense. It's actually in one of my OSCE video preps. I explained it, the order there. It's called the treatment order summary. So, and I will give you the notes for that as well. And yeah, that's going to be the order. If you familiarize that order when you are given any scenario for treatment, it would be easy for you to create a flow. And then in the exam anyway, they will probably prompt you where to do it, what's the indication. So the STEM is gonna guide you. So with that being explained, let me show you the techniques for chronic. I'll do the manual lymphatic drainage first so that I can show you the turning. Usually they are already positioned the way they should be positioned, but it doesn't mean that you can't remove them. So it's not really a big deal. If you wish to turn them, sure. If you don't, then no. Okay, so let's start first with showing the techniques. So let's start with fascial technique. Again, I just want to add a disclaimer here, because again, every massage therapist, every school, every teacher has a different interpretation of how these techniques are done. The way I'm going to show it to you is how I learned it, how I understood it from the resources, and then my suggestion is pick what's best for you, because again, some of you already learned it in the sense that you're comfortable, or your teacher taught you in a specific way, but this is just my method, so take it with a grain of salt. Okay, it's not going to be that much different anyway. Let me start with fascial technique. So again, the purpose of fascial technique is that it removes the fascial restriction in a specific area. Reduced oil would be the best, or remove the oil as much as you can, because it's hard to grab the fascia if it's oily. So earlier we did a warm-up with it, right? But let's assume that nothing happened on this back. Okay, so I'm gonna try my best to remove as much oil as possible. So let me remove all of these. Okay, so now I removed all the oil. I'm just gonna put it here on the side. Okay, so first step is to assess the area. Because how would you know where the restriction is if you're not gonna assess? So usually I use fascial cutting to assess. So right now, I'm using fascial cutting, and I feel you can even try the other side. But obviously, in OSCE, it's just one side. Okay? So let's say I felt a restriction here. So it means this is where I'm gonna be working on. Okay? If it moves something like this, like it's not hard to cut, it means the area is good. But if you're like doing everything and cutting it and it's really, hard to pull, then that's the area where you want to be focusing on. Okay? So I'm gonna work around here because this is where I felt the restriction is. So see, I'm putting a lot already and it feels like it doesn't want to go down. So that's one. That's the first step. Assess the area. Okay? It's basically engage the restriction and move the fascia towards the barrier. So basically, I engaged it, I figured it out that it's this one. Then I'm gonna start warming it up. There's two types of warm-up. You can warm up dry, because the point of warm-up is to provide hyperemia, meaning to say that the muscle is warm and warm enough to start the techniques. You can use dry techniques, but I just prefer using the oiled ones. I'll just remove the oil. So again, I'm gonna warm it up quickly. And again, everything is real time. So you cannot fake your time there. Okay? So, yeah. So let's say after some time here, I figured out that it's already red. Let's say, for example, but obviously in the exam, you have to really see that it's a bit red, not too red. So it is actually a bit red here, on my point of view at least. So I would say this is already warm. Next step, after the warm up, I will remove the oil in my hands and then remove the oil everywhere I added. So that's why I said you pick your own warm up. After that, let's do the principles of massage. Let's do the fascial technique. So I'm going to show you a couple of versions. My suggestion is pick 2 to 3. Or pick the best ones that you feel that's working. So let's start with some of it, which is skin rolling. By the way, client, I'm gonna do a technique called fascial technique. It's gonna be a pinching technique. It's gonna be a little bit painful, but I'm gonna work within your tolerance. Is that okay?
Yeah.
Okay. Then you grab the skin. This is what you call skin rolling. So I'm just grabbing the skin and bringing it going down. You can even change the barrier also and then pinch it this way, right? So that's skin rolling. We even have torquing, where you kind of push and then rotate the area, right? Push, like this is what you call torquing. Push and torque, push and torque, push and torque. This is better for like legs. We even have the C bowing, where you grab some tissue and then you create a C out of it. Or grab a tissue, like grab a muscle and then do a C, an S, or a reverse S. You can do a reverse C as well. Totally up to you. Okay? You also have the cross hand fascial glide, where you anchor this part of your palm and this palm away from each other and then stretch it. It's actually better for the lower back because it's anchoring more. For smaller tissues, you can actually use 2 fingers and then do this, like the neck. as long as it's cross hand. Steph, why can't it be like this? Because it's harder. But when you do it cross hand, you can put a little bit of weight to do it. There's also what you called J stroke. It's similar with torquing, but you pin it and then make a J. Pin it, make a J. Pin it, make a J. This is good for the IT band. Okay? Then obviously you have the fascial cutting. So you can cut it like this, or you can cut it like this, like you're slicing something, or using your palmar. Okay? So when you do the technique, pick one of those, 2 to 3 of those, whatever makes sense. Then reassess. Oh, I see that it's moving now. Once you feel that the tissue is moving, what you do is flush. Just quick flushes. It's just one unidirectional towards the heart. You just flush, and then you're done. You can move on to the next technique. That's fascial technique. So to summarize, I assessed, I warmed it up, and then once it's warmed up, I remove the oil in my hand, remove the oil from the body. Then I picked 3 techniques from the techniques I showed you that made sense, that helped me remove the restriction, and then I reassess to see if the restriction is still there. Once I feel that it's gone, I'm going to end it with a flush. And then I'm going to move on with the next technique. Okay?
Nice.
Perfect. I cannot emphasize enough, when you're doing these techniques, you want to be very methodical of how you do it. You don't have any pen and paper when you do these things. So if you know what's the first step, then the second, then the third, then the fourth, fifth, blah, 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 it's going to be easier for you to track what's going on. Earlier, I did talk to him, the client, and I explained it enough. Right? I said, hey, I'm going to do, I found here some fascial restrictions in the back. I will be treating it using fascial technique. It's going to be a little bit painful, a pinching feeling, but I'm going to work within your tolerance, and this is going to help with restriction. So you see how I explained it? Short, precise, didn't take me 2 minutes to explain. Rather than explaining it as, I'm going to do a fascial technique, which is a technique that uses the, stop talking so much. Just talk enough to let them know. So as a client, were you able to understand the technique I was able to do for you? You know, just explain it enough. I'm going to do a fascial technique because of the fascial restrictions, so on and so forth. Okay?